Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Dr. Elizabeth Cozine.
Asthma, it can happen at any time during your life. Now, for some people, they get it as a child and they have it forever. For others who have had it as a child, it may get better during puberty, but then it can come back later in life.
And for some, asthma may not develop until they're adults. How does that happen? Joining us in studio is Mayo Clinic allergy and asthma expert, Dr. James Lee. Thank you for being with us, Dr. Lee.
Great to be here.
Dr. Lee, good to see you.
Likewise, Tom.
Asthma can strike at any age. Tell us about that.
Well, Tom, you got it right. So asthma can start in childhood. It can come and go. So the adults that we see with asthma sometimes have had asthma since childhood, but others can develop asthma in adulthood.
So even adults who have never had a breathing problem, never had asthma before, as an adult can show up with asthma.
Well, that would be correct. And we think the asthma develops as a combination with genetics, environment, and infection. We do see a lot of children with asthma, but adults with asthma can have asthma start in midlife or even later in life.
So tell us, when we use the term asthma, what actually do we mean? What really happens inside the lung?
Well, honestly, there are probably different forms of asthma, but the word is used to describe a lung condition that involves the airways or the bronchial tubes. And the characteristic of asthma, Tom, is that the bronchial tubes are extra sensitive. They can become inflamed and narrowed, and that can cause shortness of breath, wheezing, and other asthma symptoms.
Shortness of breath, wheezing. What else might a patient experience?
Well, sometimes cough, sensation of chest tightness, that would be typical.
And also there's this, isn't there an overproduction or secretion of mucus, thick mucus, that can also contribute to the difficulty breathing?
That can be a big factor for many patients. So cough, whether it's a non-productive or a productive cough, can be a part of asthma as well.
And now, is this the body overreacting for some reason?
Well, that can be part of it. I think we sort of think of the condition as an inflammatory condition involving the airway, so it's inflammation. The reactions can occur because there are asthma triggers that can cause the bronchospasm or the narrowing of the bronchial tubes. Often we think about allergy-causing substances like cats or dogs or mold. Other triggers could be just environmental smoke. A smoky room or a restaurant can do it too.
So a lot of things that we could potentially have some control over. So thinking about smoking or not being in smoke or pets. Tell us about some of the ways to treat asthma.
Well, we always try to identify the specific triggers for an individual patient with an asthma, Elizabeth. And once those triggers are identified for a particular patient, then we can logically and reasonably give them advice about what to avoid. The point being, if we don't ask people to avoid substances that are not triggers for them personally.
Sure.
I wanted to ask you one other thing about symptoms and the disease itself, because wheezing, coughing, shortness of breath is one thing, but an asthma attack, even maybe your first one, can be life-threatening, can it?
Asthma attacks can be life-threatening. Sometimes it's the first one, but often it's not the first one. It's someone who has known asthma, perhaps, and has had asthma attacks in the past, and then they experience the one big one.
You forgot their inhaler, or how does it happen?
Well,
I mean, aren't these inhalers really effective?
The inhalers can be helpful. For people who we see with asthma, we always review how to recognize an impending asthma attack and how to deal with it. So ideally, patients are diagnosed, they have a plan. We call it an asthma action plan, so they know what to do. For other people, though, maybe they don't have a plan, maybe they don't have medications, or maybe it's just a major asthma attack that really requires hospital treatment.
We try to make it really, really simple for patients thinking about that asthma action plan. So talk about the green zone when they're well controlled, the yellow zone when they're maybe starting to get in a little bit of trouble. Maybe they went over to a friend's house who has a cat. What would you do in that situation? Or the red zone, which are those really scary moments where you're needing more emergency type medications.
And they have the ability to actually monitor their own condition, right? Isn't there a little handheld device where they can monitor their asthma?
Yes, there is. That would be a peak flow meter that people can use at home. But to your point, Elizabeth, the asthma action plan really should be individualized to the patient. So some action plans are pretty simple. It's who to call, when to call 911, possibly when to use your rescue inhaler or when to use some oral prednisone. that's actually not that simple, but that would be a simple one. There are more sophisticated versions of the action plan, and I think Tom touched on having patients monitor their lung function at home with a home peak flow meter, and then they can create charts. We have some people who bring computerized charts in full color, so that we can track their asthma. And sometimes a patient can fine-tune their asthma treatment as well.
Even when they come to you as an adult, is this a fairly easy diagnosis to make?
Well, sometimes it's pretty easy and straightforward. There's a sort of a prototypic type of asthma presentation. Someone who has shortness of breath, wheezing, may be triggered by cold or exercise. If they have an inhaler and they use it from time to time and it seems to help, maybe they have some seasonal allergies too, or asthma in the family, then many physicians can make that diagnosis. Usually it's confirmed with laboratory testing like breathing tests. There are other situations in adults especially where there's chest pain, some trouble breathing, but it's not so clear. So we think, well, could it be another lung condition? Do they smoke? Could they have a heart condition? So sometimes it's not that simple, Tom.
So when we talk about treatment for asthma patients, we all know about inhalers because we've seen people use them. But you also have medications that you can use. And how do you decide who needs what?
Right. So there's actually a growing repertoire of asthma treatments for patients. And we still really use a lot of the asthma inhalers. And I think your listeners will want to know that there are inhalers that I guess we call asthma controllers that we instruct patients to use every single day to quiet down that inflammation in the bronchial tubes. And then there's the albuterol inhaler that's sometimes called a rescue inhaler that's used as needed or for asthma attacks. There are also pills for asthma. There are injections for different kinds of injections for asthma. There's steroid medicines for asthma. And most physicians, and especially specialists, have those treatments available.
So it all depends on what it takes to control the disease, and it's different for different patients.
That would be true. And, one principle that we try to apply, Tom, is we want to get the right medicine for the treatment for the patient. But generally, that might mean the least amount of medicine for asthma that leads to excellent control of their symptoms.
Right.
Do you see patients who have asthma and follow
frequently.
up? Yeah?
And I would say one of the most important things that I try to convey to people that are on slightly more complicated regimens than just the inhaler as needed is that the medicine that they are using to control their asthma may not make them feel better that day. And so it's really important that we're using it to control the symptoms overall so they have fewer of these big exacerbations or asthma attacks.
Well, that's an excellent point because a lot of our management time and effort with patients is trying to prevent problems, and preventive management doesn't always feel good at the time because you're trying to prevent symptoms, prevent attacks.
And these medicines can often be very expensive for patients, and so sometimes I find that patients are trying to save them. And so what I tell them is, look, this is going to be a lot cheaper than the hospital cost if you are uncontrolled and have to come in and be seen multiple times or even in an emergency setting.
Is asthma seasonal at all? You mentioned cold as a potential trigger. Do you see more cases of asthma in Minnesota in the winter?
So asthma often is seasonal, and it can be seasonal for different reasons, right? So one type of seasonal asthma is if someone has allergies and the spring pollen or the fall ragweed pollen kicks in, then they may have more asthma during that time of year. There's the cold air in Minnesota where if someone's out there shoveling snow, their asthma may well be triggered during that activity because of the cold and the exercise. And then there's cold season, meaning catching cold season, and that tends to be in the fall, the winter, and the spring, especially for children, but for everybody. So catching a cold is a major trigger for asthma.
All right, Dr. James Lee, an asthma expert at the Mayo Clinic. Obviously, asthma, I guess, can strike at any age. Even adults who have never had asthma before can get it later in life. Asthma can be caused or triggered by multiple factors, and there are multiple ways to treat it. As we've just heard, there are inhalers, medications which you can give either by mouth or intravenously. And obviously, if you do have asthma, it's important to stay in touch with your doctor and follow up.
Our thanks to Mayo Clinic asthma and allergy expert, Dr. James Lee.
Thanks for having me.